Welcome future nurses. In today's session, we'll tackle 50 of the most challenging NCLEX pediatric questions, designed in a brand new, advanced format that mirrors the critical thinking required on test day. These questions go beyond memorization. They test your ability to prioritize, apply nursing process, integrate growth and development, and make safe, evidence-based decisions for pediatric patients. Stay focused, think critically, and use these questions to sharpen your confidence. Remember, every answer comes with a detailed rationale and strategy, so you'll not only know what is correct, but also why. Let's dive in and master pediatrics together. Question 1. A 2-year-old child is admitted with suspected epiglottitis. The nurse notices the child sitting upright, drooling, and anxious. Which nursing action is most appropriate? A. Attempt to visualize the throat with a tongue depressor. B. Place the child in the supine position and administer oxygen. C. Prepare for intubation and notify the healthcare provider immediately. D. Start in 4-line to administer fluids. Answer: C. Rationale: epiglottitis is a life-threatening emergency. The priority is maintaining airway patency. Intubation may be needed. Attempting to visualize the throat may cause complete airway obstruction. Supine positioning worsens distress. 4 fluids are secondary. Strategy: always prioritize airway in pediatrics, avoid throat examination in suspected epiglottitis. Question 2, SATA. The nurse is teaching parents about home care for a child with cystic fibrosis. Which interventions should be included? Select all that apply. A. Provide high-protein, high-calorie meals. B. Restrict salt intake to prevent hypertension. C. Administer pancreatic enzymes with meals. D. Encourage vigorous physical activity. E. Offer frequent snacks between meals. Answer: A, C, D, E. Rationale: CF patients need high-calorie diets, enzyme supplementation, exercise to mobilize secretions, and frequent snacks. Salt restriction is contraindicated. CF patients lose sodium through sweat and often need extra salt. Strategy: in SATA, evaluate each option independently. Question 3. A nurse is preparing to give digoxin to a 10-month-old infant with heart failure. The apical heart rate is 88 bpm. What is the appropriate nursing action? A. Administer the medication. B. Hold the medication and notify the healthcare provider. C. Administer the medication with food to prevent nausea. D. Double-check the dose with another nurse before giving. Answer: B. Rationale: for infants, hold digoxin if HR 90 to 110 bpm. This child's HR is 88, so medication must be withheld. Strategy: memorize pediatric vital sign ranges and medication hold parameters. Question 4, calculation. A child with Kawasaki disease is prescribed 4 immunoglobulin at 2g/kg over 10 hours. The child weighs 15 kilograms. How many grams should the nurse prepare? Answer: 30 g. Rationale: 2g times 15 kilograms equals 30 g total dose. Strategy: always convert dose/kg accurately, double-check math before administration. Question 5. A nurse is caring for a 6-year-old with sickle cell crisis complaining of severe pain. Which intervention should be prioritized? A. Administer prescribed opioids. B. Encourage ambulation to prevent clots. C. Provide aspirin for pain control. D. Apply ice packs to painful joints. Answer: A. Rationale: opioids are the mainstay of treatment for sickle cell crisis pain. Ambulation is not helpful during crisis. Aspirin is avoided due to risk of Reye's syndrome. Cold constricts vessels, warmth is preferred. Strategy: pain management in pediatrics requires safety and disease-specific considerations. Question 6, delegation. The nurse is caring for several pediatric patients. Which task is appropriate to delegate to the unlicensed assistive personnel, UAP? A. Teaching a mother how to breastfeed a preterm infant. B. Assessing pain in a 5-year-old with a broken arm. C. Obtaining vital signs from a stable 8-year-old post-appendectomy. D. Administering acetaminophen for fever in a toddler. Answer, C. Rationale, UAP can obtain routine vital signs. Teaching, assessing, and administering medication require an RN. Strategy, remember, delegate stable, routine tasks, retain teaching, assessment, planning, and evaluation. Question 7, SATA. A nurse is providing education to parents of a child with nephrotic syndrome. Which statements indicate understanding? A. We should monitor daily weights at home. B. Salt will be restricted in his diet. C. We will expect frothy urine. D. We must avoid vaccinations to prevent relapse. E. He will need corticosteroid therapy. Answer, A, B, C, E. Rationale, nephrotic syndrome causes proteinuria, frothy urine, requires steroids, sodium restriction, and weight monitoring. Vaccinations are encouraged unless contraindicated during immunosuppression. Strategy, link clinical manifestations with management. Question 8. A 3-year-old with newly diagnosed type 1 diabetes is learning insulin administration with parents. Which statement indicates a need for further teaching? A. We should rotate injection sites to prevent lipodystrophy. B. He can give his own injections when he feels ready. C. We can mix regular insulin with NPH in one syringe. D. We should aspirate before injecting insulin to check for blood return. Answer, D. Rationale, aspiration is unnecessary and painful for insulin injections. Strategy, eliminate outdated practices from pediatric medication administration. Question 9, critical thinking. A child with suspected meningitis is scheduled for a lumbar puncture. Before the procedure, which nursing action is most important? A. Administer prescribed 4 antibiotics. B. Apply topical anesthetic cream to the site. C. Ensure informed consent is obtained. D. Place the child in side-lying fetal position. Answer, C. Rationale, legal and ethical practice requires consent before invasive procedures. Antibiotics should be given promptly but only after cultures. Strategy, when multiple correct actions exist, prioritize safety and legality first. Question 10, prioritization. A nurse is caring for 4 pediatric patients. Who should be seen first? A. A 4-year-old with asthma who is wheezing lightly after albuterol. B. A 10-year-old with sickle cell anemia requesting pain medication. C. A 2-year-old with epiglottitis sitting forward and drooling. D. A 6-year-old with nephrotic syndrome and mild periorbital edema. Answer, C. Rationale, airway obstruction from epiglottitis is life-threatening. Strategy, always apply ABC, airway, breathing, circulation, in prioritization. Question 11, SATA. A 9-year-old with acute lymphoblastic leukemia is receiving chemotherapy. Which instructions should the nurse include in discharge teaching? Select all that apply. A. Avoid live vaccines while receiving chemotherapy. B. Use a soft toothbrush and avoid dental flossing. C. Increase intake of fresh fruits and raw vegetables. D. Report any fever greater than 100.4 degrees Fahrenheit, 38 degrees Celsius immediately. E. Wear a mask in crowded places until counts recover. Answer, A, B, D, E. Rationale, chemotherapy causes immunosuppression, avoid live vaccines in crowds, promptly report fever. Use gentle oral care to prevent mucosal injury. Raw fruits/vegetables increase infection risk. Strategy, in SATA, focus on infection prevention for immunocompromised patients. Question 12, prioritization. A child with bacterial pneumonia has the following orders: start 4 antibiotics, perform chest physiotherapy, administer PRN acetaminophen for fever, and obtain a chest X-ray. Which should the nurse perform first? A. Obtain chest X-ray. B. Start 4 antibiotics. C. Perform chest physiotherapy. D. Administer acetaminophen. Answer, B. Rationale, for suspected bacterial pneumonia, prompt antibiotic therapy is most time-sensitive to reduce morbidity. Diagnostics are important but should not delay treatment. Strategy: prioritize interventions that immediately treat life/organ-threatening disease. Question 13, calculation, weight-based. A 7-year-old child weighs 28 kilograms and is prescribed ampicillin 50 milligrams per kilogram per day divided Q6H. What dose, in mg, should be administered per dose? Answer: 350 milligrams per dose. Rationale: 50 milligrams per kilogram per day times 28 kilograms equals 1,400 milligrams per day. Divided every 6 hours equals 4 doses/day. 1,400 divided by 4 is equal to 350 mg/dose. Strategy: for calculations, multiply weight times mg/kg, then divide by number of doses. Question 14, SATA. Which findings are expected with pyloric stenosis in an infant? Select all that apply. A. Forceful projectile vomiting. B. Palpable olive mass in RUQ/epigastrum. C. Frequent watery stools with blood. D. Visible peristaltic waves across abdomen. E. Metabolic alkalosis with hypochloremia. Answer: A, B, D, E. Rationale: hypertrophic pyloric stenosis causes projectile vomiting, palpable olive mass, visible peristalsis, and dehydration that leads to hypochloremic metabolic alkalosis. Bloody watery stools are not typical. Strategy: connect pathophysiology, vomiting electrolyte disturbance, to lab findings. Question 15, delegation/scope. Which task is appropriate to delegate to the licensed practical nurse, LPN, caring for pediatric patients? A. Teach parents how to draw up insulin for a toddler. B. Perform tracheostomy suctioning on a stable child. C. Initiate triage assessment for an ill infant in ED. D. Perform a complete admission assessment on a newborn. Answer: B. Rationale: LPNs may perform routine technical skills like suctioning for a stable tracheostomy with RN supervision. Teaching, triage assessment, and comprehensive admission assessments are RN responsibilities. Strategy: delegate routine technical tasks, keep teaching and initial comprehensive assessments RN-led. Question 16, critical thinking/ethics. A 15-year-old requests confidential treatment for sexual activity and asks the nurse not to tell the parents. What action is appropriate? A. Respect confidentiality and do not inform parents. B. Refuse care until parents are present. C. Provide care and inform the adolescent of limits to confidentiality, e.g., abuse, harm. D. Notify parents immediately because patient is a minor. Answer: C. Rationale: minors can often receive confidential sexual/reproductive health services depending on laws. Nurses must explain confidentiality limits, e.g., reporting abuse/suicide risk. Strategy: balance confidentiality with legal reporting obligations, inform the adolescent about limits. Question 17, SATA, respiratory distress. A newborn in the nursery is showing signs of respiratory distress. Which signs indicate this? Select all that apply. A. Nasal flaring. B. Grunting with each breath. C. Central cyanosis. D. Brief periods of apnea lasting 10 seconds. E. Intermittent sneezing. Answer: A, B, C. Rationale: nasal flaring, grunting, and central cyanosis are signs of significant respiratory distress. Apnea greater than 20 seconds is concerning. 10 seconds can be normal in newborns but context matters. Sneezing is normal. Strategy: recognize classic neonatal respiratory distress signs, nasal flaring, retractions, grunting, cyanosis. Question 18, medication safety. A toddler receives oral acetaminophen 160 mg per 5 ml. The order is for 15 mg per kilogram per dose PRN pain. The child weighs 12 kilograms. How many ml should be given per dose? Answer: 5.625 milliliters, rounded to 5.6 or 5.5 milliliters per facility policy. Rationale: 15 milligrams per kilogram times 12 kilograms equals 180 milligrams needed. Concentration, 160 mg per 5 ml mg/ml equals 160 divided by 5 is equal to 32 mg/ml. Volume equals 180 mg divided by 32 mg per milliliter equals 5.625 milliliters. Follow facility rounding guidelines. Strategy, convert mg/kg total mg, then use concentration to find ml, round appropriately. Question 19, Prioritization, ER. Which child should the nurse assess first in the pediatric emergency department? A 6-year-old with fever 38.9 degrees Celsius and ear pain. B. 3-year-old with supraclavicular retractions and stridor at rest. C. 10-year-old with a laceration to the chin, bleeding controlled. D. 4-year-old with vomiting and diarrhea, tolerating sips. Answer, B. Rationale, stridor at rest with retractions indicates impending airway compromise, highest priority. Strategy, airway issues always outrank other stable complaints. Question 20, Growth and Development, developmental milestone. At 18 months, which behavior would be most concerning? A. Runs clumsily and throws ball overhand. B. Uses 10 to 20 words and can point to desired objects. C. Cannot walk independently. D. Begins to use spoon but spills frequently. Answer, C. Rationale, independent walking is expected by 12-15 months, inability to walk by 18 months is concerning for developmental delay. Strategy, memorize gross motor milestones by age ranges. Question 21, SATA, burns. A 4-year-old is brought after sustaining partial thickness scald burns to the chest and arms, 10% TBSA. Which nursing actions are appropriate? Select all that apply. A. Remove clothing and jewelry from burned areas. B. Apply ice directly to burned skin to reduce pain. C. Cover with clean, dry cloth and prepare for fluid resuscitation. D. Start enteral feeds immediately. E. Administer 4 opioids as ordered. Answer, A, C, E. Rationale, remove constricting items, cover burns, and manage pain/fluids. Do not apply ice directly, can worsen tissue injury. Enteral feeds are indicated later as per protocol. Strategy, in acute burns, preserve airway, remove heat source/items, cover wounds, manage fluids/pain. Question 22, SATA, fluid/electrolyte. A child with acute gastroenteritis is dehydrated. Which lab changes are expected with moderate dehydration? Select all that apply. A. Increased hematocrit. B. Increased BUN. C. Hypokalemia, if prolonged vomiting/diarrhea. D. Hyponatremia always present. E. Metabolic acidosis with bicarbonate decrease. Answer, A, B, C, E. Rationale, hemoconcentration HCT, BUN, electrolyte losses possible hypokalemia, and metabolic acidosis from bicarbonate loss. Hyponatremia is not always present, may be normal or high depending on losses and replacement. Strategy, link dehydration to hemoconcentration and renal perfusion changes. Question 23, Pharmacology/toxicology. An adolescent ingested an unknown quantity of acetaminophen 6 hours ago. Which lab/test/report is most important to obtain now? A. Serum acetaminophen level and send for toxicology screen. B. Liver function tests only. C. Electrolytes and CBC. D. Urine drug screen. Answer, A. Rationale, acetaminophen levels at appropriate post-ingestion timing, greater than or equal to 4 hours, guide antidote, N-acetylcysteine, administration. LFTs help later but level is critical now. Strategy, for suspected overdose, get the serum level at the appropriate time to guide antidote. Question 24, SATA, immunology/allergic reaction. During blood transfusion, a 5-year-old develops fever, flank pain, and brown urine. Which actions should the nurse take? Select all that apply. A. Stop the transfusion immediately. B. Maintain 4-line and infuse normal saline. C. Send the unit and tubing back to the blood bank. D. Document findings and continue transfusion slowly. E. Monitor urinary output and notify physician. Answer: A, B, C, E. Rationale: suspected acute hemolytic reaction, stop transfusion, keep 4 with NS, send blood unit/tubing for investigation, monitor urine/output, and notify HCP. Do not continue transfusion. Strategy: in transfusion reactions, stop and support, preserve 4 access. Question 25, legal/consent. A 7-year-old requires emergency surgery but the parent is unavailable and the child is deteriorating. What is the appropriate action? A. Wait for parental consent before proceeding. B. Proceed with emergency surgery under implied consent to save the child. C. Call social services and delay surgery. D. Obtain a court order prior to proceeding. Answer: B. Rationale: in life or limb-threatening emergencies, implied consent allows timely interventions when parents are unavailable. Strategy: know the concept of implied consent for emergencies. Question 26, case-based, cardiac. A 2-month-old with congenital heart disease has poor weight gain, diaphoresis with feeds, and hepatomegaly. Which intervention will most likely improve caloric intake? A. Offer larger volume feeds less frequently. B. Use a high-calorie formula and small, frequent feeds. C. Place infant in supine position during feedings. D. Decrease formula concentration to improve tolerance. Answer: B. Rationale: infants with heart failure tire during feeds, high-calorie formula and smaller, more frequent feeds improve intake and reduce work of breathing. Strategy: for failure to thrive with cardiac disease, support caloric density and minimize exertion. If you're enjoying this video so far, like and subscribe. Welcome back. Question 27, SATA, seizures. A child with new-onset generalized tonic-clonic seizure is postictal and sleepy. Which actions are appropriate? Select all that apply. A. Place child on side to maintain airway. B. Insert airway adjunct while postictal. C. Check blood glucose. D. Document seizure duration and characteristics. E. Give oral benzodiazepine until fully awake. Answer: A, C, D. Rationale: position to protect airway, check glucose, hypoglycemia can cause seizures, and document. Airway adjunct insertion is typically not done unless airway is compromised. Oral meds aren't given until airway/reflexes are intact. For/IM benzodiazepines are used if seizure continues. Strategy: post-seizure, airway, and glucose checks are priorities. Document onset/duration/observations. Question 28, calculation, for fluid/maintenance. A 3-year-old child weighs 14 kilograms and requires maintenance for fluids using the 4-to-1 rule, ml/hr. What is the hourly maintenance rate? Answer: 54 milliliters per hour. Rationale: for first 10 kilograms, 4 milliliters per kilogram per hour. 10 kilograms times 4 is equal to 40 ml/hr. Remaining 4 kilograms times 2 milliliters per kilogram per hour equals 8 milliliters per hour. Total equals 40 plus 8 is equal to 48 ml/hr. Weight, recheck. 4-to-1 rule is per kg, for 14 kilograms. First 10 kilograms equals 4 milliliters per kilogram per hour is equal to 10 times 4 equals 40. Next 4 kilograms equals 2 milliliters per kilogram per hour is equal to 4 times 2 equals 8. Total equals 48 milliliters per hour. Correct answer: 48 milliliters per hour. Strategy: always calculate stepwise, first 10 kilograms, next 10 kilograms, then remaining kg times 1. Note: corrected calculation, answer is 48 milliliters per hour. Question 29, psychosocial/family. A school-age child with chronic illness is showing withdrawal and declining school performance. Which approach is most appropriate? A. Recommend immediate psychiatric hospitalization. B. Assess for signs of depression and involve school counselor and family. C. Encourage the child to snap out of it and increase activities. D. Ignore until medical condition improves. Answer: B. Rationale: Chronic illness increases risk for depression and school problems. Assess, coordinate with school and family, and refer for mental health services as needed. Strategy, screen for psychosocial effects of chronic illness and coordinate multidisciplinary support. Question 30, SATA, newborn screening and care. Which statements about newborn metabolic screening and early care are correct? Select all that apply. A. Heel stick newborn screening is ideally done after 24 to 48 hours of life. B. Parents should be informed that results may take days and they will be notified if abnormal. C. Newborns should not receive hepatitis B vaccine before discharge. D. Early exclusive breastfeeding lowers risk of hypoglycemia. E. Universal newborn hearing screen should be performed before discharge. Answer, A, B, D, E. Rationale, newborn screens are done 24 to 48 hours after feeding established. Parents need to know timeline. Breastfeeding helps stabilize glucose. Hearing screen is standard. Hep B vaccine is commonly given before discharge unless contraindicated. Strategy, no routine newborn screenings and parental education points. Question 31, respiratory, asthma management. A 12-year-old with moderate persistent asthma uses an inhaled corticosteroid and a rescue albuterol inhaler. During exacerbation, which step is most appropriate? A. Give albuterol nebulizer and add oral corticosteroids as ordered. B. Increase inhaled corticosteroid dose at home only. C. Give a single dose of ipratropium only. D. Begin antibiotics immediately. Answer, A. Rationale, acute exacerbations require short-acting beta-2 agonist, nebulized or MDI with spacer, and often systemic steroids. Antibiotics are not indicated unless bacterial infection suspected. Strategy, in exacerbation, bronchodilate first, consider systemic steroids, reserve antibiotics for suspected bacterial infection. Question 32, SATA, post-op. Which nursing interventions after pediatric appendectomy are appropriate? Select all that apply. A. Encourage early ambulation as tolerated. B. Monitor incision for signs of infection. C. Keep NPO for 48 hours post-op routinely. D. Provide age-appropriate pain control, including PCA if appropriate. E. Teach parents to change sterile dressing daily at home starting Pod 1. Answer, A, B, D. Rationale, early ambulation, incision monitoring, and adequate pain control are standard. NPO 48 hours is not routine, advanced diet is tolerated. Dressing changes depend on surgeon instructions and are often done by professionals initially. Strategy, post-op pediatric care emphasizes early mobility, infection monitoring, and appropriate pain management. Question 33, endocrine. A 6-year-old with newly diagnosed type 1 diabetes shows signs of diabetic ketoacidosis, DKA Kussmaul respirations, fruity breath, and hyperkalemia on labs. Which action is highest priority? A. Start 4 fluids and insulin as ordered, monitor potassium. B. Administer oral glucose to correct hyperglycemia. C. Restrict 4 fluids to prevent cerebral edema. D. Give 4 potassium immediately. Answer, A. Rationale, DKA management prioritizes fluid resuscitation and insulin to correct acidosis while monitoring potassium closely. Potassium may fall as insulin is given. Do not give K+ until urine output and/or levels justify it. Strategy, treat DKA per protocol, fluids first, then insulin, monitor potassium and neurostatus. Question 34, SATA, ear/eye emergencies. A 4-year-old presents with sudden severe ear pain, high fever, and bulging tympanic membrane. Which are appropriate? Select all that apply. A. Start antibiotic therapy as ordered. B. Apply warm compress to ear for comfort. C. Perform immediate tympanostomy at bedside. D. Provide analgesics and antipyretics. E. Expect spontaneous improvement without treatment. Answer, A, B, D. Rationale, acute otitis media, antibiotics as indicated, comfort measures, and pain control. Tympanostomy tubes are not emergent bedside procedures, and untreated cases in some children may resolve, but symptomatic management and antibiotics are usual. Strategy: treat acute infections with symptom control and antibiotics as indicated. Question 35, SATA, poisoning/overdose education. Parent teaching after a toddler ingests a household cleaner should include which points? Select all that apply. A. Do not induce vomiting unless instructed by poison control. B. Bring product container to the ED for identification. C. Give the child milk or water liberally immediately. D. Call poison control center and follow directions. E. If child is asymptomatic, no evaluation is needed. Answer: A, B, D. Rationale: avoid home vomiting induction, bring container for ID, call poison control. Giving fluids may be contraindicated depending on substance. Asymptomatic children may still need evaluation. Strategy: poison exposure, call poison control and bring container, follow expert instructions. Question 36, neurology/development. A 2-year-old demonstrates persistent primitive reflexes, e.g., Moro reflex. This finding is most consistent with A. Normal development at this age. B. Possible neurologic impairment, further evaluation needed. C. Advanced motor development. D. Temporary sleep disturbance. Answer: B. Rationale: primitive reflexes should be integrated in infancy. Persistence beyond expected age suggests neurologic issues. Strategy: recognize abnormal persistence of primitive reflexes as red flags. Question 37, SATA, immunization/reactions. Parents report their 15-month-old developed fever and a rash 24 hours after MMR vaccine. What should the nurse advise? Select all that apply. A. This may be a normal, mild reaction, use antipyretic and monitor. B. Report as vaccine adverse event and evaluate if severe. C. Avoid future MMR doses forever. D. Seek immediate emergency care for lip swelling or difficulty breathing. E. Continue routine vaccines per schedule unless severe reaction occurred. Answer: A, B, D, E. Rationale: mild fever/rash can be normal, document/report and treat symptomatically. Severe allergic reaction, anaphylaxis, requires ER care, not all reactions preclude future vaccination. Strategy: distinguish mild expected vaccine reactions from severe allergic reactions that contraindicate further doses. Question 38, cardiac/med admin. A 4-year-old with SVT is prescribed adenosine 4-push. Which action should the nurse take during administration? A. Administer adenosine slowly over 5 minutes. B. Give adenosine as a rapid bolus followed by a rapid saline flush. C. Mix adenosine with lidocaine for pain control. D. Premedicate with atropine. Answer: B. Rationale: adenosine requires rapid 4-push over 1 to 2 seconds, followed by rapid saline flush due to its very short half-life. Strategy: no administration technique for emergency antiarrhythmics. Question 39, case, hematology/iron deficiency. A 9-month-old is found to be microcytic and iron deficient. Which instruction should the nurse give to the parents? A. Start iron supplements with vitamin C to enhance absorption. B. Avoid dairy products entirely until child is 2 years old. C. Give iron supplement with formula or milk for better tolerance. D. Delay iron therapy until after 1 week. Answer: A. Rationale: vitamin C increases iron absorption. Iron should not be given with milk because calcium inhibits absorption. Avoid excessive cow's milk but not necessarily entirely. Start iron therapy promptly. Strategy: counsel on timing, give with vitamin C, not with milk, and monitoring for side effects. Question 40, SATA, meningitis precautions. While caring for a child with bacterial meningitis, what infection control measures are appropriate? Select all that apply. A. Place child on droplet precautions for first 24 hours after antibiotics. B. Strict airborne precautions required. C. Use mask when within 3 feet of the patient. D. Limit visitors to those vaccinated against meningitis where applicable. E. No special precautions necessary once antibiotics started. Answer: A, C, D. Rationale: bacterial meningitis, e.g., and meningitis, requires droplet precautions, masks within close distance and visitor considerations are appropriate. Airborne is not typically required. Droplet precautions often continue 24 hours after effective antibiotics. Strategy: apply droplet precautions for meningitis until safe per protocol. Question 41, Psychiatric/Safety. An adolescent in the pediatric unit is expressing hopelessness and suicidal ideation. Which immediate action should the nurse take? A. Place on one-to-one observation and remove potential means of self-harm. B. Encourage alone time to process feelings. C. Ask them to promise not to hurt themselves. D. Call family and discharge home. Answer: A. Rationale: immediate safety measures include close supervision and removal of means. Promising is not reliable. Notify mental health crisis team. Strategy: prioritize patient safety with constant observation and environmental safety. Question 42, Gastrointestinal/Hirschsprung's. A newborn fails to pass meconium within 48 hours and develops bilious vomiting. Hirschsprung disease is suspected. Which assessment finding supports this diagnosis? A. Ribbon-like stools and abdominal distension. B. Frequent watery stools without blood. C. Jaundice and dark urine. D. Hypotonia and feeding intolerance only. Answer: A. Rationale: Hirschsprung disease causes a lack of peristalsis in distal colon, constipation, abdominal distension, and ribbon-like stools. Strategy: link failure to pass meconium and abdominal distension to bowel motility disorders. Question 43, SATA, burn/infection risk. Following a major burn injury, which complications should the nurse monitor for? Select all that apply. A. Sepsis and infection. B. Hypervolemia exclusively. C. Hypothermia due to skin loss. D. Contractures during healing. E. Decreased metabolic demand. Answer: A, C, D. Rationale: burns increase infection risk, cause heat loss, hypothermia, and scarring may cause contractures. Initially patients are hypovolemic, not hypervolemic, and have increased metabolic demand. Strategy: monitor for infection, temperature issues, mobility needs for contracture prevention, and nutritional support. Question 44, Pharmacology/vaccine contraindication. Which child should not receive the live attenuated influenza vaccine, LAIV, intranasally? A. A healthy 7-year-old without chronic illness. B. A 3-year-old with well-controlled asthma on intermittent inhaler use. C. A 12-year-old receiving high-dose systemic corticosteroids. D. A 5-year-old with allergic rhinitis. Answer: C. Rationale: immunocompromised children, e.g., systemic high-dose corticosteroids, should not get live vaccines. Asthma history may be considered, but LAIV is contraindicated in severe/reactive asthma. Intermittent inhaler use in some guidelines may still allow certain vaccines. Follow local guidelines. Strategy: no live vaccine contraindications, immunosuppression, certain severe asthma cases. Question 45, Case/shock recognition. A 5-year-old with septic shock has cool extremities, delayed capillary refill, and decreased urine output. Which hemodynamic pattern is most consistent? A. Warm shock with bounding pulses. B. Cold shock with vasoconstriction and low perfusion. C. Neurogenic shock with bradycardia. D. Cardiogenic shock with hypertension. Answer: B. Rationale: cold shock shows vasoconstriction, cool extremities, delayed cap refill, and poor perfusion, common in pediatric septic shock early. Strategy: recognize cold versus warm shock presentations in children. Children commonly have cold shock. Question 46, SATA, croup versus epiglottitis. Which findings favor a diagnosis of croup rather than epiglottitis? Select all that apply. A. Inspiratory stridor that improves with humidity or cold air. B. Progressive drooling and muffled voice. C. Barking cough and hoarseness. D. Rapid onset with high fever and toxic appearance. E. Symptoms often preceded by upper respiratory infection. Answer, A, C, E. Rationale, croup classically has barking cough, hoarseness, and often improves with humidity/cold air, usually follows URI. Epiglottitis presents with drooling, muffled voice, and rapid severe illness. Strategy, use distinguishing features, barking cough versus drooling/toxic appearance, to differentiate. Question 47, SATA, failure to thrive causes. Which factors can contribute to failure to thrive, FTT, in infants? Select all that apply. A. Inadequate caloric intake due to feeding difficulty. B. Chronic illness increasing metabolic demand. C. Neglect/poverty causing insufficient food. D. Genetic short stature only with normal growth trajectory. E. Malabsorption disorders. Answer, A, B, C, E. Rationale, FTT can be due to inadequate intake, increased demand, neglect, or malabsorption. Genetic short stature with normal growth velocity is not FTT. Strategy, evaluate intake, demand, absorption, and social factors when assessing FTT. Question 48, Case/Oncology, tumor lysis syndrome. A child with Burkitt lymphoma begins chemotherapy and develops hyperkalemia, hyperphosphatemia, hypocalcemia, and rising uric acid. What prophylactic/early treatment is indicated? A. Allopurinol or rasburicase and aggressive for hydration. B. Calcium gluconate only. C. Restrict fluids to prevent overload. D. Delay chemotherapy. Answer, A. Rationale, tumor lysis syndrome treated with hydration and uric acid, lowering agents, allopurinol or rasburicase, electrolytes corrected as needed. Strategy, anticipate TLS in high-burden tumors, prophylactic hydration and uric acid control. Question 49, SATA, diabetes sick day rules. A 14-year-old with type 1 diabetes is ill with influenza. Which sick day instructions are appropriate? Select all that apply. A. Continue insulin, may need higher doses. B. Check blood glucose every 2 to 4 hours and ketones if hyperglycemic. C. Stop insulin until appetite returns. D. Maintain fluid intake and seek care if vomiting persists. E. Double long-acting insulin dose without consulting HCP. Answer, A, B, D. Rationale, continue insulin, often at higher doses, monitor glucose and ketones frequently, maintain hydration, and seek care for persistent vomiting. Do not stop insulin or arbitrarily double doses, consult HCP. Strategy, emphasize glucose/ketone monitoring and insulin continuity during illness. Question 50, final, complex prioritization plus critical thinking. A pediatric unit nurse has these 4 patients on the morning assignment. Infant 3 months post-ingestion of iron pellets, currently stable but awaiting GI consult. 8-year-old with asthma who received albuterol 1 hour ago and now complains of chest tightness and mild tachycardia. 2-year-old postoperative tonsillectomy with active oozing from mouth and frequent swallowing. 12-year-old with type 1 diabetes preparing for discharge education and insulin teaching. Which patient should be assessed first? Provide rationale. Answer, patient 3 to 2-year-old postoperative with active oozing and frequent swallowing. Rationale, frequent swallowing and oral bleeding after tonsillectomy suggest ongoing hemorrhage and potential airway compromise, immediate assessment and intervention required. GI foreign body may be urgent but patient is currently stable. Asthma with mild tachycardia after albuterol could indicate expected side effect versus worsening. Monitor. Discharge teaching is important but not emergent. Strategy. In complex lists, use ABC plus risk of rapid deterioration. Active bleeding and airway risk outrank stable issues and education tasks. Great work pushing through these 50 tough pediatric NCLEX questions. If you made it this far, you're already training your brain to think like a nurse under pressure. Remember, pediatrics requires balancing science, safety, and compassion. Always use ABCs, developmental stages, and safety principles to guide your answers. Keep practicing, stay confident, and never give up on your NCLEX journey. Each question you master brings you one step closer to your license and your future as a registered nurse. You've got this, and the best is yet to come.